Hi, my name's Ian, my wife Sue. We're here in India to have a hip replacement, which was done maybe about nearly 2 weeks ago now. We came from Australia. It was a big leap to come from Australia to India, but I had this problem for so long, and I've been in a lot of pain for maybe 3 or 4 years. And because I'm a very active and sort of athletic kind of person, I was really concerned about the kind of hip implant that I would have, and I wanted one that was going to give me the opportunity to be very active once I'd finished. And in Australia, I was on the system in Australia. We have a free public health system in Australia, and I was on the system there, but the system was taking way too long for me to be able to. I was in pain for way too long, and it was just taking way too long for it to happen. And I wasn't really guaranteed that I was going to get the best kind of outcome that I would that I wanted, and that when I had the implant in Australia, that maybe I wouldn't be able to do all the kinds of things that I wanted to do. So I was really keen to get the best quality implant with the best quality surgeons that I could. So I looked up lots of Google searchings and found that in India you can get the best quality implants and with the best quality surgeons, and that you wouldn't have to wait a long time to do it, and that the price for doing it was quite within reason for what we could afford. So that prompted me to do further research, and in further research I came across Vedam Health, who brought me here to India. They found options for me in Australia and supported my negotiations with hospitals, and I found they gave me a lot of confidence. I've discovered along the way that they were real in what they were doing, that it wasn't a risky business to deal with Vedam, that they were a proper business doing proper medical support. And they put me in touch with high quality surgeons, high quality hospitals, and gave me an option to choose one particular surgeon, and I was lucky. The surgeon that I chose has turned out to be fantastic. We came to Vedam helped us with negotiating how we came to India and how we came to the hospital and the kinds of things that we would need, and set up linkages with the hospital. So when we came to India, there was somebody to meet us at the airport, take us to the hospital, where we straight away met the surgeon, and from there we were almost the next day I was on the operating table and having the operation. And then from there, the operation was fantastic. The team, the facilities were just incredible. I was just so impressed, comparable to anything that I'd experienced in Australia, that's for sure. And then waiting back at the recovery, back at the ward, and for 5 days in hospital, the support of the clinical staff. We had a fantastic room. My wife Sue was able to stay in the room with us, so that meant she was able to support me and to negotiate things with the hospital staff when I needed them, and to do all kinds of things to support me and to support them, and to maximise and optimise the outcomes that we had. And the staff were really professional, even down to the people who cleaned the room. They seemed to really know what was going on. They were very respectful. They were supportive, and they knew when there were medical lines to cross in. They knew what they had to do in a medical situation. And same with all of the medical attendants and the nurses, just thoroughly professional. And I felt really confident in terms of the clinical hygiene, which is something that coming from Australia, people are concerned about. But we found that to be absolutely fantastic. The dressings on my wound and stuff like that were waterproof dressings, so it was all clean, sealed, and the dressing and the treatment for just we weren't exposed to anything the risk of post-operative infection, which is the main problem, second main problem after the operation in coming to India, has turned out so far to be fantastically well dealt with. So no signs of infection. The wound itself is nearly healed. I've had the staples out. I have a really nice waterproof dressing on it now, so by the time another week's time that should be completely healed, and so that risk of post-operative infection should be pretty much well and truly over. So then it's just a matter of getting time. The doctor was able to organise physiotherapy. Once I was discharged from the hospital, and then the physiotherapist has been coming to our room, so I've had a physiotherapy program at our guest house room, and that has been wonderful because we haven't had to travel backwards and forwards to the hospital to deal with physiotherapy. And our room itself, Vedam has organised a nice, what would you call it, a guest house? It's a guest house, yeah. In a nice, really nice neighbourhood, close to the hospital. It's only 500-600 metres away from the hospital. And it's a thoroughly kind of safe, friendly, supportive community where everybody talks to you, and everybody's wondering how you're going. So by the third day, everybody knows you and recognises you and says, "How's it going?" And really kind of keen to help you along and to talk, ask your story and take an interest in you without any feeling that they want to get anything out of you. They're just being friendly. So it's been absolutely fantastic in that way. And so pretty soon, the next few days, we're going to be heading off to spend some time up in the foothills of the Himalayas at a health spa where we can relax and help and just progress the recovery phase. We've decided not to go straight back to Australia because we think that there's a huge risk if we go back to Australia. I just want to avoid the risk of deep vein thrombosis from flying long haul, but also if I went back to Australia, I would have lots of jobs to do, and I would be very tempted to get in and do them, and really I don't need to be doing that while recovering from my hip replacement. So it's better to stay away, and so we've organised a long journey home that's going to take us until now it's early December, so by mid-January we'll be back in Australia, and just having nice, relaxed, comfortable stays for a couple of weeks at maybe 2 or 3 different places with not a lot of travelling, just small flights and train trips in between. So that's our kind of how we've organised our process of recovery, and other people may be more keen to get home and to get back into the comforts of home. But here we are now. I've met the Vedam office people and found that their office is a nice kind of business hub where they're connected via business processes and digital connections to all of the various hospitals and patients, and where all the
services,
where the action happens from their point of view, and it's fantastic. I'd recommend it to anybody who is, I guess, thinking about needing the kind of hip replacement that they want, with confidence in the surgery team and the clinical recovery process in hospitals. And if you're comfortable coming to India, I'd give it a shot for sure. Thoroughly recommend it.